Good morning and welcome to the San Francisco Interfaith Council online briefing for faith leaders. Today's program will feature San Francisco Health Officer Dr. Susan Phillip as she addresses the COVID-19 Omicron variant, its impact on our city, and the Department of Public Health's strategic response.
A special thanks, the San Francisco Interfaith Council online briefings are supported by a grant from MetaFund. Thank you. The important and ongoing work of the San Francisco Interfaith Council would not be possible without generous funding from congregations, corporations, faith-based social service agencies, foundations, judicatories, and supporters like you. Help us spread the word. Visit sfinterfaithcouncil.org to learn about SFIC programming and how to become a supporter. Follow SFIC on Facebook and Twitter, and subscribe to SFIC's YouTube channel to watch all of our virtual events. A bit of housekeeping. This program is being recorded. For audio and video, all participants are muted and without video to minimize distraction. To submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. Questions will be forwarded to the presenter for their review following the program. For closed captions, select the live transcript button at the bottom of your screen and click Enable Live Transcription. San Francisco and surrounding counties are requiring masking in indoor public places for everyone as a precaution against the increased circulation of COVID-19. This includes settings like houses of worship, grocery or retail stores, theaters, and family entertainment centers. For the most updated information, go to sf.gov and anyone 12 and older will need to show proof of vaccination to go indoors in some places in San Francisco, like bars, restaurants, clubs, gyms, large indoor events, and any business or event serving food or drink indoors. To find your vaccination record, go to myvaccinerecord.cdph.ca.gov. The vaccines are safe and effective. And now the San Francisco Department of Public Health is opening up COVID-19 boosters to all adults 18 years and older, provided they qualify based on the timing of the previous dose of the vaccine. Go to sf.gov/get vaccinated to find a vaccine site in your neighborhood. Now is the time to come together, San Francisco. Together we can stop Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, call the SFPD at 415-553-1133. And at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for faith leaders. On November 26, 2021, the World Health Organization classified a new variant, B.1.1.529, as a variant of concern and named it Omicron. And on November 30th, 2021, the United States also classified it as a variant of concern. The Centers for Disease Control has been actively monitoring and preparing for this variant and is continuing to work diligently with other U.S. and global public health and industry partners in its discovery and response efforts. A person in California became the first in the United States to have an identified case of COVID-19 Omicron variant. This week's online briefing for faith leaders, hosted by the San Francisco Interfaith Council, welcomes San Francisco Health Officer Dr. Susan Phillip, who will explain the Omicron variant and how it could potentially impact our city and the Department of Public Health's strategic response to mitigate its spread. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other, that we might better understand the multiplicity of faith traditions in our city and in our world. We are so pleased this morning to have with us the Reverend Malcolm Clemens Young, who is the Dean of Grace Cathedral, who will ground us in a reflective moment this morning as we prepare for our featured presentation. Malcolm, it is so wonderful to have you with us, and thank you and thank Grace Cathedral for all that you all have done to be leaders in the city among faith communities in our response to the pandemic.
Thank you, Michael. After baptism, not long ago, I went out to lunch with a family and I sat across from a man named Bob, who holds several land speed motorcycle records. He's a tremendously humble and courageous person, and he had fascinating stories about the danger, techniques, the mechanics of racing engines, and the culture of the people who gather for the Bonneville salt flats for racing. I love talking to experts in almost any field because I love to hear their stories and how they articulate their challenges. Jan Martel, the author of The Life of Pi, is an expert on stories. He believes we need to make it a conscious practice to regularly examine the stories we tell ourselves, which can help us to make sense of what happens to us. And I think a lot of what we need to do after COVID or in the midst of COVID or this phase of COVID is to examine the stories that we tell ourselves. Martel had an interesting project called What is Stephen Harper Reading? For those of you who may not know, Stephen Harper was the Prime Minister of Canada at the time. And Jan Martel had attended an event that was honoring about 50 Canadian artists in the House of Commons. And Martel noticed that a lot of the politicians seemed relatively unmoved by the art that they were seeing. And he wrote very sympathetically about how busy they must be and imagines how they even might be, quote unquote, deluded by busyness. So Martel points out that to read a book or watch a play or see a movie or to look at a painting or experience a beautiful garden, or for that matter, even to have a religious experience, you need a kind of moment of stillness. You can't be constantly busy. So Martel writes this: "This is what I propose to do, not to educate, that would be arrogant, less than that, to make suggestions to Harper's stillness." So every 2 weeks, Martel sent the Prime Minister a different book with a thoughtful letter about his sense of the book's importance. Stories matter, and Martel went to the top in his effort to change the stories of a whole nation and culture. I don't know what events have modified your story lately, but a lot of COVID has modified my story, my self-understanding, the story of our congregation, the story of what it is that we're doing together. But in the holy season of Christmas, I wonder how God is working to change our story so that we can thrive. One way that God changes our story is through scripture. And because we've seen so many very cute manger scenes on Christmas cards, we forget how much cruelty there is in the story. Matthew writes about Joseph's deliberations about whether or not to abandon his pregnant fiancée. There's a prophecy predicting the birth of a child who will grow up to be a king, and it provokes an unscrupulous King Herod to kill all the infants in the region. He commissions 3 magi from the east to unwittingly act as his spies. Unfortunately, the angels intervene. They warn the family to escape down to Egypt, and surrounded by death, this one child survives. The angels terrify the people that they meet. And even from our vantage point centuries later, we know that the good news that they bring is true. This child from a simple family born in controversy, threatened by kings, would forever change the course of human history. Perhaps this is in large measure because of the stories Jesus himself tells about our longing, our confusion in God. Jesus tells stories about a kingdom in which even the powerless and the outcasts are welcome. He talks about a father welcoming home a disappointing but beloved son. Jesus says, "Follow me." And over time, these stories become our stories. They change our life and our relationship with God. Of course, when it comes to our stories, we have a choice. Prime Minister Stephen Harper never wrote back to Jan Martel and may not have read a single word of all those books. Perhaps he did not want to be exposed to anything that would change his story. I wonder how this year, this holy season, will change your story. Perhaps it will help you to see the world out of the perspective of gratitude so that you can notice what God is giving you. Maybe you'll learn to be more forgiving of others and of yourself. At the very least, maybe the Christmas story will open up some silence in your life in the way that Jan Martel hoped to do for Stephen Harper. Do you remember my friend Bob, the motorcycle racer? Later, I learned the circumstances that brought us together. Bob's son was in my friend Russ's command in Iraq. And when the son was killed, Russ was the one in charge of helping the family. You might think that a parent would have too many sad memories and never again want to see the person who talked to him about this, but the two men have become very good friends. So there we were in an Italian restaurant after the baptism of Russ's newborn, brought together by a child's death and a child's birth, with light hearts, telling stories and laughing as if we were at table with God and all the angels beyond the end of time.
Thank you so very much, Malcolm. This was wonderful in terms of grounding us for today, but also thank you for the questions that each of us will be pondering in the days and weeks to come. Bless you.
Thank you, Michael.
Okay. To introduce today's featured presenter, we are very privileged to have with us the president of the San Francisco Health Commission, Dan Bernal, who is a longtime friend of this council and whose work has supported our work. Dan, it's wonderful to have you with us, and please, by all means, introduce our featured presenter.
Thank you, Michael. And just a point of clarification, when I learned that Dr. Susan Phillip was going to be addressing the council today, I reached out to Michael to ask if I could have the privilege of introducing her because of her extraordinary work on behalf of the city and county of San Francisco and its people. Thank you, Michael, for your kind introduction, for your leadership in the San Francisco Interfaith Council. Congregations throughout our city have played a critical role in informing and protecting the health of our communities and caring for our families in the spirit of our city's patron saint, St. Francis of Assisi, and doing so in a way that is culturally and linguistically and spiritually appropriate to them. So thank you to everybody here who's gathered on this call. When the COVID-19 pandemic first hit, of course, our city was guided through the earliest days by our former health officer, Dr. Tomas Aragon, who was then brought to the state to help guide efforts statewide. And towards the end of last year, when we learned that Dr. Susan Phillip was going to be taking over as our health officer, it inspired great confidence, not only within the department and within the Health Commission, but I think throughout our city. For those of you who had the privilege to know and speak with Dr. Phillip, she is an incredibly caring person. She carries credentials that are more numerous than could be mentioned from the University of Chicago, University of St. Louis, where she received her MD, and then an MPH, Master's in Public Health, from the Harvard School of Public Health. She has also been with the Department of Public Health since 2005 and has been an HIV primary care provider at the San Francisco Clinic, really caring for those in our city who are most at deep need. And I'm especially grateful to her for her leadership and the way that she cares for San Franciscans. Just very briefly, it was really only a matter of time before the Omicron variant was detected in the United States, and it's no surprise that it was first reported in San Francisco. San Francisco, with our public health infrastructure, with our academic resources through UCSF, is better positioned than anywhere in our country to both detect and respond to emerging COVID-19 variants. Our response has been the most effective in the country by nearly every measure, thanks to the leadership of London Breed, Governor Gavin Newsom, and of course the people of San Francisco. We have one of the highest vaccination rates, one of the lowest death rates in the country, because the actions of our residents have taken from the beginning of the pandemic to keep each other safe in response to the very thoughtful and very important health orders that have been issued by Dr. Susan Phillip. And just the last thing that I'll say before introducing her is, the California Department of Public Health, after reinstating their indoor masking mandate, had later clarified that it would allow counties like San Francisco, who have kept in place masking orders since August to maintain their existing health orders around masking. And that acknowledges the hard work of the people of San Francisco and the leadership of Dr. Phillip and Dr. Grant Colfax and the rest of our leaders at the Department of Public Health. So it's really my great privilege to introduce Dr. Susan Phillip to share with all of you information about the Omicron variant, our newest health orders, and how you can continue to protect our community. So thank you to the Interfaith Council, and thank you to Dr. Susan Phillip. It's my, I'm just very proud to have the opportunity to introduce you.
Thank you so much, President Bernal. What a kind introduction. And as I was saying before, I was very surprised and honored to have you give the introduction. Thank you for your leadership, and to all the commissioners on the Health Commission. You hold us to a high and correct standard, and you've supported our mission to advance the health and flourishing of people in this city with equity at the forefront. So thank you so much for your leadership and your support and guidance of our work.
Thank you.
Thank you all so much for the invitation to join you. Thank you, Director Pappas. Thank you, Reverend Dr. Young. What a beautiful reflection. And I am so happy to be with you all again. I know it's been a little while, a lot has happened, so I'm glad that we'll get a chance to talk. When I was with you the last time, I really spoke to how I see the connection between our work in public health and your work in trying to increase flourishing and well-being and connectedness across the city. And if nothing else, COVID just reminds us again and again how connected we are and how much we need each other. And we need each other to be healthy and flourishing for our own sake, as well as the sake of our neighbors. So I know that this group is so connected to the idea of equity, the idea of recognizing all of us in San Francisco and supporting this entire city. So thank you. And thank you very much to Trey. If you're able to bring up my slides, I will go ahead and begin. And I'm looking very much forward to a conversation. So I wanted to, yes, talk to you about Omicron. And when we planned this, I think we didn't know how relevant this would be. But I also want to talk us through and bring us through the path that we've taken as a city through this pandemic. It, for me, in January will be about 2 years since we started working on this. And I know it's been a very long time for all of us, for everyone on the council, and all of the people that you work with and serve. And we're all very tired, but San Francisco can be very proud of the things that it's accomplished and the way in which it's saved lives. Next slide, please. So to show us a little bit graphically about where we've come, this is our average case rate per 100,000 population. When we look at cases per 100,000 population, we can then do comparisons across different cities in the US because we control for the size of our city's population. And when we look, we see these surges or these rises that have happened over time. We had one initially in the spring and then one in the summer. And our very largest one was last winter. Those were very, very dark and difficult times. And we were just starting to see a glimpse of what might be possible with vaccines. So yesterday, it's really wonderful. Yesterday was the 1-year anniversary of the first vaccine given in San Francisco and how far we've come. So we will talk about that a bit more. So after vaccines, our cases came down. You know, we were really talking about opening up and loosening restrictions, and we were able to do a lot of that. And then in late summer, we started hearing about the Delta variant of the coronavirus. And we saw its rise throughout the world and throughout the country. And we were not spared from that either. We saw our case rates go up. And, you know, at that time, we said we were going to put back face coverings, and we've been cautious throughout as a city as we've proceeded through this. Our case rates have come down again, but very recently we're seeing another rise, and we don't know yet how far it's going to rise, and we'll talk a bit more about that. But again, our approach has always been to say, we want to make sure that we're saving lives. We want to have controls in place that allow us to maintain the ability of our healthcare system and our hospitals to function. And we also want to do the least restrictive measures possible that will enable us to do those things. So it is always a balancing effort. And vaccines have really played a critical role And those are now the mainstay of our focus. Next slide, please. We also know that cases are not evenly distributed across the city, as with many other health conditions and other factors in life. Where you live, the color of your skin, your immigration status, all of those things have an impact on your likelihood of getting COVID-19. And that is true here in San Francisco as well. The darker blue cases are blue areas and neighborhoods have higher case rates per 10,000 residents. And what we have done as a health department and as a city is to work with community partners, to work with some faith-based organizations to make sure that we are making services available and vaccinations available in the sites that have the highest rates. And then I also want to say on the side, I hope you'll excuse me, I am recovering from a little bit of a non-COVID cold that my 7-year-old very thoughtfully shared with me. We'll go on to the next slide, please. So, we talk about cases, and what we are seeing with vaccination is that there is a little bit of an uncoupling of cases and hospitalizations. Usually cases increase, and then about 2 weeks later, when the disease, the infection has a little bit more time to become a little bit more severe in some people, unfortunately, we would see a rise in hospitalizations. And so you remember the kind of general shape of the graph that we looked at with cases. The same general shape applies here, but now we're looking at people with COVID in our San Francisco hospitals. And what we saw is that last winter, when we had that height of cases, we also saw an increase in our hospitalizations to 256, which then thankfully came down. We had a slight increase again to 123 with Delta, and we are now around 34, 35 hospitalizations. I am so grateful to the people of San Francisco. I am so thankful to all of you. We never had a situation, as was seen in other parts of the country and the world, where our hospitals were overwhelmed and we were not able to take care of not only COVID patients, but anyone who might need care, including for heart attacks or motor vehicle accidents. So that is one of the real tragedies of COVID, is not only certainly for the individuals who have COVID and need care themselves and are suffering, but anyone in the city who would need access to care. So the actions that this entire city, you all, your teams, your congregations, and the people you serve have done have spared San Francisco from that really difficult situation. Next slide, please. So the key to all of this since a year ago has been vaccine. And San Francisco has done a tremendous job. The people of San Francisco have really stepped up, have understood the importance of getting vaccinated, and have done this better than any city in the United States, as President Bernal said. So if we look at San Francisco residents of all ages, this was data from just a few days ago on the 12th, but it is already outdated. We have now reached 80% of all residents of all ages who have completed their primary series, have gotten either one dose of a Johnson & Johnson or 2 doses of Moderna or Pfizer vaccine. We have been so happy to see expansion of vaccine, and now we have our 5 to 11-year-olds who are eligible. When we look at all residents that are 5 and older, everyone that is now eligible, we see 83%. When we look at those who've been eligible a little bit longer, 12 and up, it's 86%. And we know that COVID is most serious for people who are older. So it is wonderful that our residents 65 and up and 75 and up have had such a high rate. And then we in general have had over 5,000 residents a day receiving a booster dose. And we are increasingly seeing the importance of booster doses, and we'll talk a little bit more about that. Next slide, please. Again, because this is not an equitable vaccine and how it's distributed, we have to be deliberate in making sure that the vaccines get to the communities that need it the most. And so we have looked at our data by race and ethnicity, and we've worked deliberatively in partnership with community to make sure that we have vaccine accessible and easy for all communities. And you see here our estimates of percentages with a complete series, and this work continues. Next slide, please. When we look at vaccinations by age, we also want to understand here by different age strata, where again, we might need to partner or might need to do some messaging to get more people vaccinated. So here we have placed very hopefully and expectantly the 0 to 4 age group, but as you know, those ages, those children are not yet eligible for vaccine, but we're waiting, and we will include them and add them into the totals once they are. We're hearing that it might be the early part of the year for the older children in that age group. So maybe the 2 to 4 year olds might come first, and then they'll do continued studies and evaluate for the youngest infants. But our 5 to 11 year olds who have most recently become eligible, I'm so happy that 55% of kids in this age in San Francisco have gotten at least 1 dose, and over a third have completed their primary series. The 12 to 17-year-old adolescents pretty much put the rest of us to shame. They and their families have been tremendous about going out, and over 90% of them have gotten their full vaccination series, which is so wonderful. We want to continue to encourage the 25 to 34-year-olds. 74% is not bad, but we would love to push everyone up to closer to 80, high 80s, 90%. And so that continues to be an area of message and focus. And as we said, for older residents in San Francisco, we've been very pleased with how much uptake there has been of vaccination, because we know that this is a life-saving intervention for people at all ages, but particularly for people who are 65 and older. Next slide, please. So booster doses, this is always the question of how are we thinking about booster doses? How are we measuring booster doses? You know, within San Francisco, about 44% of all the people who have gotten their original vaccine have already gotten a booster, which is wonderful. And we want that to continue and to increase. And when we also break that down by age group, we see again that the 65 plus ages of residents in San Francisco, 64% of them have gotten a booster. And what I would say is that if there are people that you work with or people that you serve in your congregations or in your organizations, please do continue to encourage people to get boosters. Everybody now 16 and up is eligible for a booster. That was just expanded by the CDC very recently. But we want to make sure that everyone gets a booster, but we especially want to make sure that people who are 65 and older are getting boosters. You know, we have heard that it's been sometimes challenging to get boosters. The staffing, there have been some staffing issues at some of the pharmacies, and it's been difficult to get a booster quickly. We are working to see if we can figure out some solutions to that to increase access, but I would say to continue in efforts to support people to go ahead and get that booster. We'll talk about this a bit in relation to Omicron, but even for Delta, the data are really suggesting that the effectiveness of the vaccines are quite good, but they do decline over time. And so it does become important to go ahead and get that booster dose. Next slide, please. And, you know, in summary, as President Bernal said, San Francisco has been a leader throughout the country. This would not be possible without the leadership that you all have taken on and that every resident in San Francisco has done to stay safer, to keep themselves safe and each other safe. And it is such a privilege to work and serve a city where that is the case. So when we look at many measures and we look at some very large comparator cities, when we look at new cases, when we look at the deaths relative to population and the percent that are fully vaccinated, all of these things are really a remarkable testament to San Francisco and a testament to what we can accomplish if we all put our heads together and work towards something. COVID-19 is not the only issue to be solved, only difficult issue that needs to be solved. And there are many ways in which we can take some of the lessons learned and apply it again to ensure that there can be health and flourishing and equity throughout our city. So I wanted to leave like sort of the story of COVID-19 in San Francisco there. It's a hopeful note. And I think it establishes that we are as well equipped as any city to handle any of the challenges that come. Next slide, please. But now, of course, we were, we were doing well, and we have a new challenge that we are going to have to take on, and that is the Omicron variant. Next slide, please. So this was first identified, I think people have seen this. This is relatively recent, right? It was just the week of Thanksgiving that we started hearing about this. It was first identified in South Africa and Botswana in November. But it's really important to note that South Africa has a very sophisticated surveillance system. And so it's very possible that this variant could have been, it could have originated or been present somewhere else earlier. And South Africa, absolutely, their scientists and their leaders did the right thing. When they identified this new variant, they notified the world. And that is exactly what we would hope that the United States would do, or any other country, because we are such a connected people globally. The World Health Organization named it a variant of concern, which is the highest level of possible concern for variants that may have the potential to spread rapidly or cause more severe illness. And they did this on November 26th, so just a couple of days after it was first identified. This variant is dramatically different from Delta. Delta became the variant that has taken over globally and in the United States. It's currently still the most dominant variant in the United States, but Omicron really got people's attention, and everyone has been studying and looking at it very carefully. Next slide, please. So what is different about Omicron? It has a lot of mutations, and 50 overall. So Delta had less than 20. And when we look at the mutations, this is compared to the original strain that first emerged, and we consider that the original. And so the number of mutations and changes are always compared to that one. This is a cartoon of what the coronavirus SARS-CoV-2 is the official name looks like. And I think we've all seen this. This is a cross section, and these things that look like golf tees are the spike protein. And it is one part of this, the N, the receptor binding domain, that actually comes into contact with receptors in our body, in our respiratory tract, called the ACE2 receptors, and allows binding and allows the virus to infect. So there are mutations along this spike protein and along the receptor binding protein. And some of these have been seen in past variants, but some of them are new. The ones that were known and had been seen before had sometimes been associated with increased transmission or a decreased time for increasing cases or faster spread. And the receptor binding protein, we don't know if it means that the antibodies may not recognize it as easily, whether it's faster to stick to the receptors. So there's lots of questions that arose when the sequence and these mutations were identified. Next slide, please. And when we look at South Africa's curves, this in general is somewhat similar to what we saw. We saw summer, we saw a rise there. Their summer, of course, is winter and vice versa. But around the same time in August and then in December, a rise just as we saw. They had a very significant Delta peak here. A lot of cases there with Delta. But if you look at this line since late November, early December, look at the sharpness of the rise here, and look at how Omicron really has taken off and is now really established there in South Africa as well. And a lot of our understanding of the clinical and the transmission qualities of Omicron are coming from colleagues in South Africa and scientists who have the ability to take this data and study it and inform the rest of the world. Next slide, please. And since we are so connected, it was identified initially in South Africa and Botswana, but it is very rapidly spread in just a few weeks. to over 80 counties in every continent except Antarctica. The darker orange here shows countries in which there is local transmission. Initially it was thought that this was going to be associated with travel in most cases from South Africa, from Botswana. But what we see here is that within the United States, within other countries, there are people who are testing positive and having Omicron that have not traveled anywhere. And that tells us that it is established already and is spreading within a country. So, at that point, the focus is less on travelers and travel and more on really understanding and strengthening our population's ability to ward off Omicron. Next slide, please. So again, as President Bernal said, we had the opportunity to really identify the first case that was detected in the United States of Omicron in San Francisco. And again, I will say very strongly that I fully believe that this was not the first case in the country. This was just the first case detected. And nonetheless, it really established that Omicron was here and that our public health focus really had to shift internally to what we were going to do to try to control it as scientists were working to understand it much better. So we detected this in San Francisco in a resident on December 1st. It was someone who did live in San Francisco, had traveled, so had returned on November 22nd. This person really did all the right things. So again, going back to saying how it is such a privilege to work in San Francisco, this was a very informed person who went and got tested when they developed symptoms and called us at DPH. They didn't wait for us to call them. They called us and said that they had traveled to South Africa and had a positive test. Our team was then quickly able to mobilize and talk with this person and make sure that their specimen was delivered from the place that they tested to the laboratory of Dr. Charles Chu at UCSF, who was able to test it, worked through the night to get us a result early in the morning on December 1st. And by interviewing and following up when testing the context of the case, we have not identified any additional cases. But we do know that as of yesterday, there have been cases in 36 states. And in the Bay Area, Alameda and Santa Clara counties have also had cases. So we certainly know that Omicron is in California, it is in the Bay Area, and we want to make sure that people are informed of the steps that they can and should take to protect themselves and those around them in San Francisco. Next slide, please. So a little bit of the science or what is known now about Omicron, and more data comes out almost every day. There's a tremendous amount of laboratory-based and real-world epidemiologic studies that are happening of Omicron in South Africa, in the United Kingdom, which is also seeing an increase in cases. And the early data is somewhat hopeful that it might not cause more severe disease than Delta, but we need more time to confirm that. The population in South Africa is much younger than in many other countries like the US, and therefore it's a healthier population. The initial cases were concentrated in travelers who also are younger and healthier on average. So we will be seeing, especially from the UK, with a little bit of that time lag, as we said, how the outcomes look for their hospitalizations and more severe illnesses. One of the things that's a little concerning is that lab studies and reviews of the Omicron cases in the UK suggest that the vaccine booster doses are needed to prevent symptomatic infection, getting an infection where you have symptoms of COVID-19. And 2 doses of the vaccine are less effective against Omicron than they were against Delta or any of the other variants. And if you've just had had COVID-19, one of the prior variants, and recovered, that's even less protective than having had 2 doses of vaccine. So what this variant, I think the key take-home message is that if people have not been vaccinated, they should get vaccinated. If they've been vaccinated and they are eligible for a booster, they should get that booster. Routine tests will still detect Omicron. It does not escape and evade our tests. And we think that the upcoming antiviral treatments are going to be effective against Omicron. But again, that's being studied right now. This is just a graph of some of the data that shows vaccine effectiveness. So being higher on this number is good. And then across the bottom is time since vaccine. And what we see is Delta is in the squares, dark squares here, and Omicron is in the circles. And Omicron, doses of vaccine, no matter what time period that you look at, it's a little less effective. But we can counter that and bring up the effectiveness by getting a booster. This happened to be Pfizer, but the data looks similar for Moderna as well. And so again, this idea of getting the booster is really important. Next slide, please. So what are we doing and how are we thinking about this in San Francisco? Well, the data continues to emerge and people really want certainty, but again, we're trying to balance this and do the least restrictive measures that will still, again, allow people to stay as safe as possible, prevent a surge in our hospitalizations, and certainly we don't want any additional deaths due to Omicron. But as a city, all the work that we have been doing for almost the past 2 years has made us relatively well positioned. We have very high vaccination rates, as you've seen. People are understanding and going and asking for boosters. So we're doing 5,400 boosters a day, which is really important. We have had careful health protective orders in place for a while. And our goal is cautiously look at the Omicron data. The UK is going to give us some idea about how this disease and this virus variant behaves in a population that is similar to the US and to San Francisco. We want to gradually remove restrictions as we're able. And really, we don't want to have to move backwards if we can help it. But again, we're going to have to adjust with what the virus shows us and what the science and the data really are saying. We again are so happy and so blessed, I can't say this enough, to have well-informed residents who have kept each other safe, kept themselves, their families, and each other safe. And then such strong partnerships with academic and faith-based and community-based organizations and health systems, so many resources and so many people who are committed to doing the right thing for themselves and their neighbors. And we are in a region that has similar strengths and similar values. And so that, again, also makes us safer as a city. Next slide, please. The key message is that we really want to encourage vaccination and boosters. I think we were saying when Delta came, look, you really want to be vaccinated against Delta. And Omicron seems to be doubling every 2 days in the countries that are tracking it carefully, like in the UK. It already is making up 13% of cases in New York and New Jersey and 3% of cases overall in the US. And it seems to spread more quickly than the Delta variant. So we do want to encourage vaccination and boosters. The good news is that, vaccination likely does prevent against the most severe forms of illness if you're infected with Omicron, but breakthrough infections, which can happen now, are likely going to be more common, and we are going to have to come into a equilibrium with SARS-CoV-2. It may be a trade-off. Some people are postulating the virus becomes more transmissible, but has to become less virulent. There are often trade-offs like that. And it is possible that that is what we'll see with Omicron. But until we can confirm that, we are going to approach this very cautiously. We're planning now for how we're going to use and deploy the antiviral drugs. They are not readily available. These are oral antiviral medicines, which will likely, we're hoping, be game changers in keeping people out of the hospital when they test positive. But these are going to be in very limited supply. And so again, we're going to look with an equity lens. We're also going to look at who are the individuals who are most likely to get very sick and die if they don't receive these drugs. We're going to continue to improve testing access because people need to be able to easily get a test to know if they have COVID-19. And then when required by the local order, when indoors, using masks, and not just any mask, but I think now thinking about what's the best quality mask that you can wear comfortably. So a K95 or a KN94 surgical masks are better overall at filtering and keeping out viruses than cloth masks. And you want to find one that you can wear comfortably. Next slide, please. So, I mean, I think there's a lot there. I know people are very worried about Omicron. I think I'm cautious, but I think that the city has prepared as well as it possibly can, and we have been able to adapt and learn and weather prior challenges and prior surges. And I have every confidence that we'll be able to do that together here as well. So, thank you all.
Thank you so much, Dr. Phillip. This was both a comprehensive as well as thoughtful presentation. And I just wanted to remind everyone that this presentation will be sent out in the form of a recording link by day's end today. We were very, very blessed to receive a number of questions from our faith leaders, which at this point we would like to pose to Dr. Phillip. The first comes from the Most Reverend Salvatore Portaleone, the Archbishop of San Francisco. The Archbishop asks this question: as new variants to the virus continue to emerge, generally speaking, do they become weaker, get stronger, or remain unpredictable as to which way they will go?
Thank you. That is an excellent question. It can be somewhat unpredictable. And usually in public health and science and clinical medicine, we will err on the side of assuming that they could cause a severe illness. They could spread more rapidly. All of the features that we don't want to happen might be in place as we are looking for more data. But in general, the goal of a virus is to spread to as many people as possible. Hence the common cold virus I seem to have gotten from my son. And it is possible that SARS-CoV-2, the virus that causes COVID-19, will eventually mutate to become more transmissible, but less virulent, causing less severe disease. And we may end up just having this as part of our normal universe of viruses that we might come in contact with, but it won't have the same impact in terms of worrying that we're going to have an increase in severe cases and hospitalizations and deaths. So it remains to be seen. But there usually is a trade-off. If a virus spreads faster, usually it is less virulent to the host, because they want the host to be walking around and spreading it to others. But we have to reserve our full judgment till we see more data coming out of different countries.
Thank you. The Reverend Elaine Donlan, Minister Assistant at the Buddhist Church of San Francisco, notes, our temple opened up in late October, and one of the protocols is that everyone, both ministerial team and attendees, must be fully vaccinated and masked the entire time. What is becoming a challenge for us is to define fully vaccinated. Is it both vaccinations plus the booster, or just the initial vaccinations? And she goes on to ask a clarifying question. How would you explain the risk to some who have received the J&J last April, but no booster, received the Pfizer, both doses, in March, but no booster? And most importantly, what is the risk to our senior congregants who are fully vaccinated, first, second, and booster, and also attending with those perhaps not fully vaccinated?
Thank you. Those are such critical questions, and it really gets to the heart of some of our conversations in public health and in infectious disease medicine about how we should proceed. The official definition of fully vaccinated per the CDC and the state, and still according to our health orders, is completing the primary series. And I think that is more of the term that we'll start hearing. Have you completed your primary series of vaccine? And that would cover both getting one dose of J&J or 2 doses of either Moderna or Pfizer. Increasingly with the data, not just from Omicron, but also from Delta, we're seeing that the boosters are needed in order to prevent infection. The primary series likely has a high amount of protection against the most severe illness and death, but in order to prevent ongoing spread of COVID-19 to others, it is increasingly important to have the booster. So the question about, are we going to redefine 3 doses as the new standard for being fully vaccinated? We don't know that yet. We're going to take our lead from some of our federal and state partners. There are other vaccines for which the terminology is are you up to date on your vaccination? And that may be where we get to with COVID-19 rather than, we're done. We're fully immunized and we're done. But I think that remains to be seen. Your question about people who are in attendance, who are older and have been vaccinated and gotten their booster, they're doing everything that they can, for their health. And if people are all wearing masks as well, then that's very protective. People who are vaccinated, it is important for people to get their boosters. But I think this is all a balance. And we saw that not being able to participate in worship, not being able to participate socially has costs as well. So I would say we will update recommendations if we feel that any of the current activities have to stop. But in the meantime, I'm so grateful for all of you for encouraging and requiring mask wearing and encouraging vaccination among the people that you are working for and with. Those are the main ways that we're going to be able to prevent people from getting ill. There is a certain amount of people's own level of comfort and we all take risks, right? We get into a car, we do all these other things. COVID-19 is relatively new, but it will become the same sort of thinking about overall health and risk and taking those factors into account. But masks and vaccine are absolutely the best way to stay safe.
I should note on that particular instance that you just described that a number of our congregations are requiring proof of vaccination before entering the sanctuaries. So we would just say that. Reverend Norman Fong of the Presbyterian Church of Chinatown notes, last week I got my booster shot along with many residents living in the Ping Yuan projects in Chinatown. We also had a food bag giveaway at the same time, so there were lots of people there. Chinese hospital staff gave the shots. My question is, what is DPH's plan to go more into the community in the year ahead?
Well, thank you for describing that event. I mean, that is exactly the type of event that we want to have as a city. And whether DPH is doing it directly or there are other partners like Chinese Hospital or community-based organizations or faith-based organizations, we know that the trusted messengers and the trusted institutions within communities are the best people who are positioned to get the message out about boosters and to make sure that the events are appropriate and tailored to what the community wants and needs. So even though we are not always doing them directly, we are working to help coordinate, understand where additional efforts for boosters might be needed. We do have mobile teams that are going to support, for instance, our skilled nursing facilities, our residential care facilities for the elderly, because we know that those groups are high priority. And the neighborhoods that are very dense and have had higher cases in the past are also areas for boosters. So very open to suggestions for if there are areas for improvement or ways in which you think we can continue to improve our booster uptake across the city. But we know it's a very important partnership between community and between the city and DPH.
Thank you. His Eminence Metropolitan Yerasimos of the Greek Orthodox Metropolis of San Francisco says, given the important role that clergy and spiritual leaders play in the community and on the front lines in supporting the spiritual, emotional, and mental health needs of individuals, specifically in times of crisis, illness, and death, can anything be done now to ensure priority access to future vaccines, boosters, and self-testing kits for this group of essential workers?
Thank you so much. And I completely acknowledge the key role that you all play in serving and supporting the people of your congregations and of your communities. So what we've tried to do is place vaccination and testing accessibly throughout the city. That right now with boosters, we're working to see if we can decrease some of the bottlenecks and increase the speed with which people can get them. But I take your suggestion really to heart. And I think we'll continue to think about ways in which we can make sure that you all and other essential workers are able to access vaccine and boosters and testing as well. So thank you so much for that question and that comment to really consider and think about.
I'm sure the Metropolitan is appreciative of your answer, as is the Interfaith Council. Hala Hijazi, Commissioner for the San Francisco Human Rights Commission and also a member of our board of directors representing the Muslim community, notes, for Muslims praying inside a masjid who must perform obligatory wudu, purification of certain parts of the body with water, in the masjid's bathroom in preparation for performing mandatory prayers, what are the best practices to take into consideration for the masjid leaders and for the individual congregants who may need to perform wudu in the masjid's bathroom?
Thank you. Thank you for that question. Early on in COVID, we were much more worried about surfaces and picking up the virus by touching things. And now we have seen increasingly that it really is all about respiratory transmission. So the primary thing that would be helpful in protecting health for the people who are worshiping is vaccination, and that would be the most important thing to encourage. The other thing I would say is that if it's possible to keep masks on while doing the washing and the rituals, that would be another very important thing to do and aligned, with our health order. And then finally, if the bathroom has a window open to the outside and it's possible to do that, if you can open that window, anything to get airflow going and improve ventilation, if it's an older building or if it's a more new building, then to make sure that the ventilation system is adequate for filtration. I think those are the three steps in the order of importance that I would suggest.
Wonderful. John McKnight, who you know from the San Francisco Human Rights Commission, he's our treasurer, but he led the virtual outreach team for the COVID Command Center, asked this question. Many houses of worship struggled to reopen. Our congregants remain vigilant and isolated. We need to know how to talk to people about safety and quality of life amidst the growing number of variants and ongoing pandemic. What advice and encouragement can you give us and our congregants about their hopes to return to their spiritual community?
Hey, thank you so much for this question. I spoke to it just very briefly a minute ago, but it is such an important point. I think sometimes, from our public health viewpoint, we are thinking narrowly about COVID-19. I want to make sure that I am always refocusing that health and flourishing is beyond just the absence of being infected with a virus. There really is a need for connection within faith communities, within houses of worship. People have lots of needs that have to be met, and avoiding COVID-19 is one of many things that people will be considering in creating a flourishing life for themselves and for the people around them. So I think, we want to make sure that we're not being too alarmist. People are going to be very worried about Omicron, like what does it mean? And it is always a balance because I don't have all of the answers yet. And what I can say is here are the ways in which people can be best prepared. And the good news is we're not having to scramble at the last minute because San Francisco has been preparing this whole time. And the key standards that are in place are still the backbone, namely vaccine and now boosters. And San Franciscans know how to keep themselves and each other safe as well. And that people have taken on masking and have understood its importance for themselves and for other people. I think all of these things have to be in a balance. Now during the holiday season, and there are a lot of people gathering in observances in very meaningful ways throughout the year for commemorating their ways of worship. We want to make sure that people understand that, again, this is going to be a balance. And as the health officer, when there is a need to do something additional, we will be clear, as we always have, to say that this should happen in San Francisco in order to keep people safe. But I think that what we've said now is people can continue their usual way of life. They should be connected to each other. They should be connected to their houses of worship. And they will need to do a little bit of a person by person calculation of what that means. Is there someone in their home who is immunocompromised or who cannot get the vaccine? Then they may behave, somewhat differently. For most people, though, we're going to have to just fold this into our every day. We make calculations. I walk around, I'm a pedestrian in San Francisco. Sometimes that can be, a little scary as well. But we do these things because it's just part of living. And we will get to a point like that with COVID-19 as well. You don't know exactly where that is, but we're working towards getting closer to that. So I appreciate that question. We definitely want people to to understand what can keep them safer, and then incorporate that into their own sense of how they're going to move forward and stay connected to the houses of worship and the people that are important to them.
Risk of taxing your generosity, and I know we're going to have to end soon. We do have 3 very quick questions, and allow me to put them to you if that's okay, Dr.
Yes,
Phil.
and I will give quick answers. I'm sorry,
Okay.
I get carried away about this.
Oh, that is quite all right. You've blessed us with your time. Bishop Megan Rohrer of the Sierra Pacific Synod of the Evangelical Lutheran Church in America asks this question: from what we currently know about Omicron, is there anything new about how it spreads that faith communities should begin preparing for? Is this simply a reminder to remain vigilant, or something we need to adapt to as we worship?
You know, there's nothing inherently different about the way in which it's spread. It's still respiratory. So the protections that we talked about, vaccine and boosters and masks, those are the key things. So keeping those things in mind, people can proceed with worship, with gathering, as they have done. And people should just be mindful. And I know San Franciscans do that. Just keep your ears and eyes open. And if anything changes, you know, we are not shy about coming and saying, this is what we know now. It's not that we're changing our mind. We are always having to incorporate new information.
Wonderful. Marvin K. White, the Minister of Celebration at Glide, says really thinking about the reopening of Glide to tourists and the portrayal of the variant as an invasive species. Do we need to temporarily return to safety protocols that ask recent local and international travelers to isolate for a certain number of days? Are there people of concern if there is now a variant of concern? Which, if any, of the safety measures and protocols should we double our efforts? What are the stats to look out for that help us see if a rollback or a shutdown is imminent?
Great. You know, such an important question. You know, very early on, the president announced that there would be travel restrictions from some South African countries, but we very quickly saw that we are such a connected world that is not going to be that's not going to be the thing that protects us. We are going to just have to be aware that Omicron is in the United States, it's in California, it's in the Bay Area, and we are going to have to continue having some care around the things that we know can keep us safer. So no, there are no people of concern or even travel of concern right now. We really are just asking people to focus down on the basics, keep up with the vaccination, get your booster shot, wear your masks when you're required to do so. And that will be really important. Now, the metrics to watch out for is, you know, we do look at cases because those tend to rise faster, earlier than hospitalizations. But what we really, really care about is that hospitalization metric. Because as I said, we may get to a point where COVID-19 is no worse than a common cold. You know, I won't say that we're there yet, but then we'll stop counting all the cases because we know that they're not going to lead to very severe outcomes. That's the reason we're so concerned about cases. So more to come on that. We are mostly going to look at hospitalizations, but if we see the cases rising very quickly, we may say that we need to do some additional steps until we can understand the outcomes down the line.
Wonderful. John Paul Soto, who is the Deputy Director for the North Coast area of Lutheran Social Services of Northern California, asks a 2-part question. Will city and county government agencies that have mandated vaccinations require employees to get a booster shot? And do we expect the city and county of San Francisco to require nonprofits and agencies that contract with them to mandate vaccination?
Yes, thank you so much. And San Francisco was very proactive around requiring vaccination. But I want to do one point of clarification. As the health officer, I did put a health order in place that required vaccination in certain high-risk settings where there were more vulnerable people. So skilled nursing facilities, hospitals, shelters, jails, and that was across the spectrum, whether they were private or public or city. But then the city of San Francisco also decided as a policy, not a health order, but a policy, that they were going to require vaccination. We have not yet been having conversations about whether the booster shot will be mandated or not. I am starting with talking to people, talking with you all and other groups about the importance, because we want people to start voluntarily doing that. And we'll see as Omicron progresses. I think the data will continue to come out. We usually will look to our federal and state partners in public health to see what their discussions have been. It's always better to do something like that more broadly rather than in one city. But if need be, as a region or as a city, we will take those additional steps if the time comes. But we're not there. We're not there yet. But as always, we will come back and tell you all, tell the public, tell this group what they need to know if there are additional steps that are necessary to stay safe.
As we come to a close, I received a text from Trey, and a number of the folk in the chat are wondering about holiday parties. Now, if you were hosting a holiday party or if you were attending one, what advice would you give?
With holiday parties, again, if you're not sure, or if there are people who are unvaccinated or you don't know their vaccination status, it's not fun. It's a bummer. But the better thing to do would be to keep those gatherings small, or wear a mask when you're not actively eating or drinking. Unfortunately, Omicron does have the potential to spread more quickly. There will likely be, some of us will likely get breakthrough infections. It's not necessarily a failure or a thing that was done badly. It's likely to happen. So getting the booster and trying to have gatherings, make sure that people are vaccinated at the gathering is an important step to take. But we're not telling people to cancel gatherings. We think gathering is important. The other thing I would add is consider testing before your gathering, and doing that as soon as possible, as close to the time of gathering as you can, especially if there are older adults or people who have not yet been able to get their booster. That can be a really important step. So that's a great point. Thank you for raising that question, because I think testing is another tool that we have. And we're trying to figure out how we can work to get rapid tests into the hands of as many people as possible, but they are available for purchase, and we're going to work with state and federal partners to make sure they can be as accessible to all as they can be. So vaccination, testing, and people should enjoy themselves. It's an important time of year. People want to come together and have that sense of connection. So we certainly encourage and recognize doing that as safely as possible.
Dr. Phillip, thank you. You, as always, you've been so informative. And again, this recording link, as well as your slide deck, will be going out to our 5,000 e-subscribers by day's end today. We had a record number of people at the height, over 70, on this call today. And I know that this will be shared broadly within our community and within our sector. If you need to excuse yourself, that is totally understandable because of the work that you're doing, but we thank you.
Thank you so much again. And I can't thank all of you enough, the board, all of the people that you represent in the communities, for the partnership and the work. It really is a privilege to work alongside you in service to San Francisco. Thank you.
Thank you, Dr. Phillip. And I want to thank Reverend Malcolm Clemens Young from Grace Cathedral and Dan Bernal for their contributions today, and would like to also invite you to join us in the new year when an official from our city's law enforcement community will address the troubling issue of COVID-19 related scams that prey on vulnerable populations, how they're conveyed, and ways in which they may be reported. That date and time will be announced once our presenter is confirmed. And to all of those who will be celebrating the holidays in the coming days, we wish you all a beautiful holiday and look forward to reconvening in the new year. God bless you and God keep you.